While I'm getting this up, Dr. McEwan, you want to go ahead and start just introducing your work?
Yes. So good morning or good afternoon, everyone. My name is Sophia, and I am presenting on, well, the topic of my project is bridging expectations, I'm sorry. Advancing inclusive maternal care through evidence-based communication and support. And having a baby is one of the most exciting times or exciting experiences that a woman can experience. And sometimes it just doesn't go as expected. So this project seek to show how if we had better communication, um, if we could improve that experience for our moms. I would like to get these off my screen. I am so sorry, everyone. I am having difficulties with these slides, Dr. Ballard.
This is Dr. Erlene. Sophia, are you able to see your own slides?
No, because the participants, I can see them in the slide on the page as well. So I'm not able to see my slides.
Can you close the participants? Can you X out where the participants are?
I don't think I can do that. No, I'm not able.
Are you saying that the Zoom
Yes,
participants list is in front of your
yes,
notes?
it is.
Can you make the Zoom screen smaller by clicking on the square next to the X for the room? Or sliding the screen so it's not full screen? And then you might be able to shrink the Zoom screen and see your slides behind that.
Okay, this might work, yes.
I changed the view to show Sophia's screen. Does that help?
Yes.
Okay, and then if Sophia, if you could say, like, when you click on the one of them at the beginning, it should give you an option like to play the slideshow.
She's not, Dr. Schwartz, she's not, this is Eva. Eva's clicking through the slides.
Oh,
Sophia's
okay.
not, because we couldn't get her notes to pull up. And so we're trying to figure it out how she can go through her slides on her end and Dr. Ballard clicking through the slides, which Dr. Ballard pulled up. So, Sophia, if you make the Zoom room smaller.
They're gone right now, so.
Okay.
All right, we're on my Y.
Okay. All right, yes, I'll start there. So I'm a doctor of nursing practice, prepared a nurse with more than 20 years of experience in maternal child health and obstetric care, especially in labor and delivery. Over the years, I've had the privilege of working closely with expectant mothers and seeing firsthand just the challenges that they face through pregnancy, through labor, and even through delivery. So what really drives my work is a passion for improving maternal outcomes by keeping care patient-centered. I place a strong emphasis on education and empowerment because I've seen how much of a difference it makes when patients feel informed, when they feel supported, and when they are actively involved in their care. So my practice is grounded in evidence-based care and quality improvement, which also guided my doctoral work. I'm especially interested in how technology like digital education platforms can be used to make information more accessible and engaging for patients, and ultimately improving their overall care experience. At the heart of it, though, my goal is simply to keep advancing maternal health care in ways that truly support mothers and their families and lead to better outcomes for everyone involved. Next. So through my clinical experience, I've noticed some consistent gaps when it comes to patient knowledge and preparedness, especially around childbirth education and birth planning. So many patients, they would come in unsure of what to expect, and sometimes that uncertainty can really shape how they experience labor and delivery. I've also seen how much of a difference emotional support makes, having emotional support or not having support. When patients feel supported and heard, their overall experience tends to be much more positive. On the other hand, of course, when that support is lacking, it can significantly impact not just the patient, but it also impacts their families. A lot of the dissatisfaction that I've encountered seem to come from a mismatch between expectations and the realities of labor and delivery. When patients aren't fully prepared or they don't have a clear understanding of what might happen, that can lead to frustration and then disappointment. So that's really where my academic training in evidence-based practice and quality improvement comes in. It's helped to take a more structured, systematic, and patient-centered approach to addressing these gaps, focusing on ways to better prepare, educate, and support patients throughout their journey. So one of the key challenges addressed in this project was the issue of unmet childbirth expectations. The gap between what people expect childbirth to be and what actually happens. So this gap can have a big impact, not just on the mother, as we said before, but also on their families and even the broader community. Research shows that many women go into labor with certain expectations, and we all have those expectations too, but the reality can be very different. Things like unexpected medical interventions, longer labor times, or complications can all change the experience. When that happens, it can lead to feelings of disappointment, loss of control, sadness, and overall emotional distress. Some parents may even feel overwhelmed or powerless, which can make the transition into parenthood even more difficult. So all of this highlights just how important it is to better prepare and support our families so their expectations are more aligned with the realities of childbirth. So this project grew out of a desire to better understand how structured education and communication impact the childbirth experience. At its core, it looks at whether providing expectant mothers with clear evidence-based resources can truly make a difference in how they experience labor and delivery. Several patient-centered outcomes were to be assessed, including satisfaction with labor and delivery, level of preparedness, and confidence in their decision-making. I also wanted to capture the emotional side of the experience, whether patients felt supported, in control, or anxious during the process. This project also explored how integrating structured education into prenatal care influenced patient engagement and communication with healthcare providers. So the focus of this project was on improving maternal childbirth satisfaction by strengthening patient education and enhancing communication throughout the perinatal period. To support this, two key components were introduced. One, we introduced a structured birth plan and a series of evidence-based educational videos. The goal was to provide patients with reliable, consistent information that was easily accessible whenever they needed it. Together, these two tools were designed to help expectant mothers feel more prepared and supported throughout the labor and delivery process. By providing clear information and a way to communicate their preferences, the goal was to promote informed decision-making, reduce uncertainty, and help these women feel more confident and satisfied with their childbirth experiences. So when we look at the literature supports what's often seen in practice, that patient education and patient-centered care play a critical role in shaping a woman's childbirth experience. For example, Townsend and colleagues pointed out that maternal satisfaction is closely tied to how well a woman's expectations will match her actual birth experience. When there's a gap between the two, that's often where dissatisfaction begins. Other authors highlighted how important evidence-based antenatal education is. They found that when patients received clear, reliable information ahead of time, they tend to feel more knowledgeable, they feel more confident, and they're better prepared for labor and delivery experience. The literature also shows that shows how impactful the birth experience can be on maternal mental health. Negative experiences don't just end at delivery. They can contribute to postpartum depression and anxiety, which made this even more important to address. Webb and colleagues, they also emphasized the value of patient-centered care and strong communication. And we know this is very important. When providers actively involve patients, listen to their preferences, and keep them informed, it led to better decision-making, higher satisfaction, and overall, a more positive maternity experience. So my PICO question was, for expectant mothers scheduled for elective induction of labor, how does implementing ACOG, My Birth Plan, and Lama's Healthy Birth Practices, Labor and Childbirth Information videos impact satisfaction with childbirth experiences over 6 weeks? So the project focused on low-risk term pregnancies to ensure the safety of the participants and also clinical relevance. Purposive sampling was used to recruit participants directly from the clinical setting, resulting in a final sample of 30 expectant mothers. The sample was primarily Hispanic or Latino, with participants ranging in age from 18 to 42 years. The largest group, however, was between 23 and 27 years old. Most of the participants were multiparous, 87% of them reporting between 1 and 3 prior pregnancies. However, most of them had at least 1 child. Clinically, the majority underwent elective induction of labor at 39 weeks of gestation, which is in alignment with ACOG guidelines, while the remaining 17% were at or beyond 38 weeks gestation. Participants first accessed the Lamaze educational videos on YouTube, which provided evidence-based information on some healthy birth practices. They were encouraged to watch the videos with their partners or support person before completing the birth plan tool. After reviewing the content, the participants would create a personalized birth plan using a printed copy of the tool. They were asked to complete it prior to their scheduled hospital admission. And upon arrival, the birth plan, they would bring the birth plan, they would discuss this with their healthcare providers, so their nurses or their midwife, and they would discuss how they could integrate and incorporate what they wanted or their preferences into the clinical picture. So successful implementation of the project relied on strong collaboration across multiple disciplines to ensure coordinated care and effective delivery of the intervention. A combination of staff and digital resources supported the process, including tools that enhanced patient education. Certified medical translators, they were also involved to promote inclusivity and ensure information was accessible to participants from diverse linguistic backgrounds. Prior to implementation, ethical approval was obtained and informed consent was secured from all participants. Throughout the project, data collection, storage, and management followed strict HIPAA regulations and IRB guidelines to ensure confidentiality, to protect the participants' privacy, and to maintain regulatory compliance. So data were collected after the participants completed the educational interventions and experienced labor and delivery. So we collected the data in the postpartum period. Maternal outcomes were measured using the Birth Satisfaction Scale Revised, or the BSS-R for short, a validated self-report tool that assesses overall satisfaction, emotional responses, and perceived support during childbirth. Objective clinical data, including mode of delivery and any complications, were obtained from the electronic health records. And to ensure accuracy, data was verified through both manual chart audits and automated extractions. By combining patient-reported outcomes with clinical data, this approach provided a more comprehensive understanding of the interventions or the impact of the interventions on both the childbirth experience and clinical outcomes. So all data were handled securely in accordance with HIPAA regulations and, again, IRB guidelines to maintain privacy, confidentiality, and ethical integrity throughout the study. To evaluate the effect of the intervention, the 10-item birth satisfaction scale revised tool was administered in the postpartum period, as I'd said. The BSS-R is a validated instrument that was developed in 2014 to assess women's experiences of childbirth. The scale demonstrated acceptable to good internal consistency that reported Cronbach's alpha valuing ranging from 0.79 to 0.85. This brief questionnaire assesses key domains of the childbirth experiences, including perceived quality of care, support from healthcare professionals, and the woman's sense of control and coping during labor. It also captures stress-related factors such as labor duration and obstetric complications. Collectively, The BSS-R provides a comprehensive measure of maternal birth satisfaction and identifies potential areas for improvement in intrapartum care. So this project used a quality improvement approach that was grounded in established nursing and evidence-based practice frameworks. Implementation occurred at the clinical site and was supported by strong interdisciplinary collaboration, which helped to integrate the intervention smoothly into existing workflows. Stakeholders were engaged early on in the process, helping to build support, ensure alignment, and promote the long-term sustainability of the project. So the project primarily used descriptive statistics to summarize key outcomes. Because it was a single group design, inferential statistical tests weren't appropriate. Instead of comparing groups, the focus was on describing and evaluating the outcomes that were observed within the project. The BSS-R was used to assess the mother's childbirth experiences. Overall, satisfaction levels were high, with all the participants scoring above 20 on the scale. And the mean score was 26 with a range from 20 to 30. In terms of outcomes, most participants, or 28 out of the 30, reported feeling physically and emotionally unharmed following childbirth. Additionally, approximately 47% of women disagreed with the statement that labor felt excessively long. This suggested that many perceived that their labor experience was manageable and not overly prolonged. Overall, patients' experiences were very positive. Nearly all participants reported that communication was effective and that they were highly satisfied with their care. Most of the women felt supported when making decisions and described having a strong sense of control during labor and delivery. And the educational tools that we introduced played an important role here by improving knowledge. It improved their engagement and their overall preparedness, which helped create a more positive and empowering experience for the ladies. So what they showed was that even though most participants felt supported overall, their emotional experiences during labor still varied. Despite strong education and communication, a notable portion of participants continued to experience anxiety, which suggested that support didn't always fully address emotional needs in the moment. The variation in distress levels also reflected how differently individuals experienced labor. Some women felt calm and prepared, while others felt overwhelmed, particularly with labor, when labor did not go as expected or it became more intense. So the sense of control was an important finding. While the majority felt in control, about 30% did not, which may have reflected situations where care decisions changed quickly or communication was less clear during critical moments for them. Overall, these findings suggest that while the intervention was effective, there is still an opportunity to strengthen emotional support, particularly by focusing on anxiety management, coping strategies, and ensuring patients feel involved and heard throughout their childbirth experience. In conclusion, this project showed that combining maternal education with structured birth planning can significantly improve maternal outcomes, improve their satisfaction, communication, and overall engagement in perinatal care. The intervention helped strengthen patients' understanding of and preparedness for labor and delivery. while also supporting shared decision-making through individualized birth plans. Participants reported more positive birth experiences, highlighting the value of pairing education with structured birth planning. Overall, the findings supported the effectiveness of evidence-based, patient-centered care in obstetric care and suggested benefits not only for patient experience, but also for overall care quality. Ultimately, integrating maternal education and birth planning into standard obstetric medical practice has the potential to enhance childbirth experiences and promote better outcomes for both mothers and newborns. So some unanswered questions, which I wondered which component had the greater impact, the videos or the birth plan? Another question was, would outcomes differ if one element was removed or even modified? Would outcomes differ in non-Hispanic populations? And how effective are the materials across different literacy levels and languages? Those are some of the unanswered questions. And while the project showed really positive outcomes overall, there is still some clear opportunities to improve or for improvement. One big area is expanding the educational materials to include more languages and culturally tailored content. That way, the information feels more relevant and accessible to a wider range of patients. There's also room to make the learning experience more interactive, adding things like simple quizzes, discussions, or digital tools could help patients stay more engaged and feel more involved in the process. Looking ahead, it would also be helpful to study the long-term impact. Right now, we're seeing positive results during childbirth, but it would be valuable to know if better education continues to benefit the mothers and the babies during the postpartum period and beyond. Overall, these next steps could help to build on what's already working and making the intervention even more effective. With that, I say thank you very much. It was a pleasure. So I guess we'll open now for some questions and answers.
Thank you, Dr. McEwan. All right, that was a wonderful presentation, very well presented. We'll open it up to the group. You can ask questions or type them in the chat. Okay, we do have a question from Dr. Oline. Do you think a mother's history of having a baby prior plays a part in their anxiety during this time?
Thank you, Dr. Owen, for that question. I do think it does play a role in their anxiety level. If they had a good experience before, then, the general feeling sometimes that they're, a little bit calmer, or they know what to expect, especially if too they had that experience within the same facility. If they had an experience that was less than ideal or what they expected, then those patients tend to be much more anxious when it comes to, the same situation again. And sometimes those patients do want to share what they went through so that, you're now aware of, their situation, and, of course, they expect a different outcome.
Thank you for that.
You're welcome.
Yeah, we have some nice comments. Thank you for advocating for improved maternal outcomes. No questions. Excellent presentation and project. Well done. All right, Dr. Oline has another question. After going through this project, what would you consider adding to maternity care to improve the anxiety that mothers feel?
Well, definitely education. That has just been one of the big things from this project in the area that I worked at. We actually implemented a birth plan, and it's generic. You can put whatever you would like to put on it, what you would like to experience. So we actually implemented that birth plan, and we also on the maternity section of our website, we included some videos. So the hospital actually invested in purchasing some videos, and they're in different languages. So the patients can actually go on the website, click on that, and they actually have the education or some education, if they need it. So that's one thing that definitely, I think, going forward, more facilities and providers, need to implement to educate our moms. And the information is there not just for the moms, the support, the family, and also it shows what a hospital offers, because sometimes people will come and they expect something that's not offered. So, that also gives them an opportunity to see what this facility offers and, how they can modify or how we can modify to best fit everybody's needs. So.
Thank you. There's another question. Have you had an opportunity to continue the interventions that you implemented in your study? And if so, have you compared them to your study's finding?
So as I said, we have implemented the birth plan, and we have put the educational videos on the website. I have not actually compared them. I'm not at the facility anymore, so maybe there's a disconnect there, but I've not really been able to compare them. But I know that the videos are still there and the birth plan is still there because I've checked.
Do you feel that a one-on-one educational experience over a video would enhance the education experience?
Definitely, because one-on-one, you can ask your questions, but also if you watch the videos, it gives you an opportunity when you go back to your provider, because the video is there all the time. So if you have, if there are questions, then, you can discuss this in the antenatal period with your provider. Or a lot of hospitals have birth classes, and that would be a good, medium to discuss some of the questions or concerns that one might have. But definitely, if you're doing it one-on-one, patients tend to feel more, maybe they feel more comfortable with that, and just asking their questions and getting a response right away is probably better for some people.
And certainly with the videos, it's a standardization of the quality of the communication that the new mothers are receiving. Let's see. It says the provider has to be responsible too to follow up with the mom to make sure she doesn't have any further questions. Often new moms are shy with their questions. So so you're right that conversation it's difficult to standardize.
Yes. And that's why it's so important for it to be happening in the antenatal period.
That's right. Is there anything else that you'd like to share with us, Dr. McEwan?
Well, just that Well, for everybody, those of us who can influence, have, any say, just definitely advocate for our new moms. And this isn't just for obstetrics, but for all our patients. We definitely need to be advocating for them. They do have a voice, and they do have expectations. And sometimes we should try to accommodate those expectations, at least find out what they are, and not just do things because we can.
Great. Well, thank you so much for your time and your excellent work and presentation. Thank you all for joining. Wonderful job. And hopefully you'll join our continued presentations throughout the week. Thanks, everyone.
Much. Thank you for having me.